think we're here today to try and inform as many veterans as we can. We're here with Dr. Bash.
Welcome, Radio Land, TV Land, and YouTube viewers and listeners. This is Dr. Craig Bash. I've been doing veterans medical opinions for 30 years, and I have dozens and dozens of these radio shows which we're going to publish on this YouTube channel, and number 1 through whatever. So thank you for listening, and here we go.
Today our guest speaker is Dr. Craig Bash. He's a specialist in medical diagnosis, radiology, or my gosh, you're into everything, Dr. Bash. How are you doing today?
Good, Dr. Bash here. I'm good. We'll answer some questions and see what topics you guys want to talk about.
Yeah, we was wanting to start off with this Fayetteville thing. What's your feelings on that? Where they cost some veterans their lives, and something should be done about it.
Yeah, it's good. I mean, this is all, I think, a rebound of when they funded the Inspector General last year. You know, the VA put a bunch of money and FTEs into the Inspector General's office. And so these detailed evaluations of doctors' performance are very difficult to do. And so the Inspector General has a bunch of doctors, and they heard about problems, and they went and did a deep dive research and found that pathologist was impaired, and then they are now going back and trying to document all the different cases that he reviewed that were wrong. You know, the problem with my field, radiology and pathology, are oftentimes the last time the final diagnosis. And so if a pathologist calls something normal or calls something abnormal, or if a radiologist calls something normal or something abnormal, that can have a huge impact on the patient's life, because oftentimes that stuff's never reviewed again for maybe a few years when the cancer gets out of control. So it's really sad. It sounds like a lot of patients were injured and died because of that process. It's good that the VA's got the Inspector General looking at it, and it's good they're going back and reviewing all those cases, which has taken them some time, so they can try and correct the problems. But the impaired physicians can cause a lot of damage.
I believe it goes back more than just 3 or 4 years. I had a brother-in-law down there. They didn't diagnose him till he was in stage 4 cancer. And, of course, he didn't last long after that. Cancer was all through him. And that's been about 10 years ago. So I don't believe this is a new problem.
It went back to 2005 with this pathologist, Gerald.
Yeah. Well, VA doctors, Well, VA doctors, doctors could stay in one place for a long time, 30 years. So if he was marginal for a while, it could cause a lot of problems. And it's hard to, they said he did something like 30,000 cases in a year. So hospitals have a quality assurance program to try and look at things, to double check on doctors. But sometimes these pathologists or radiologists, sometimes at the end of the line, and you don't have, you only have 1 or 2 of them in the whole hospital, so you can't really review the work very easily. You got to send it out. If you have clinic doctors, other doctors can review the work, with pathology and radiologists so specialized that nobody can really read what they're doing,
Hmm. Yeah.
Well, it's too bad it happened. There should be a way of keeping check on this sort of thing. So,
well, there is now. He got fired.
Oh, is it? Well, yeah. He got fired.
But in 2016, they found out he was messing up, and they put him in some sort of special rehabilitation program. I think it's geared specifically to doctors, which is a good idea because, let's face it, a lot of doctors become addicts. I don't know if the man's problem was alcohol or drug abuse, but they felt he was clean, and they let him back into the VA, let him do his regular job again, after, I guess, he was in quite a few months in the rehabilitation program. And that's when he started messing up again, and he became impaired again, and that's when they were getting complaints from his coworkers. They just couldn't put up with it anymore. And he did get fired. But so far, they've looked at 900 cases. They found 7 definite misdiagnosed veterans and 2 potentially possible deaths caused by this pathologist. A lot of the news is inaccurate, and believe me, I'm trying to get it squared away with some of these people. Some of the news in Arkansas said Congressman Westerman was told by the VA that the pathologist did cause 1 death so far. I called Westerman's office in Washington, and his public affairs officer told me, no, they said he may have caused 1 death. I said, oh, that's different. I said, I think he may have caused 2 so far. They didn't want to hear that. But Fayetteville, VA, their own interim director is trying to keep this, as he said in the newspaper, as a local incident. And that's why you're not hearing it yet on Fox News and this and that. And I already called the White House and griped about it. And they filed a complaint for me because I feel VA Central Office should make a statement on this, because you guys know these veterans, we're talking about veterans that were treated there in 2005 on up. A lot of those veterans didn't stay in Arkansas. They moved. They might have given their regional office their new address for a claim, but maybe they never gave it to the medical center. And you all know VA is very good about sending out letters that never get to who they send them to, you know, like C&P exams, appointments. Yeah.
For sure.
Yeah, so I don't trust what they're doing. It's going to get bigger before it gets better. But that's all I have to say.
Yeah, Dr. Bash, it should get really big because, you know, VA has hundreds of radiologists and hundreds of pathologists, and all those guys' work should be reviewed somehow systematically. Probably sent, you know, a certain percent should be sent to other hospitals outside or inside to double check, because this might just be the tip of the iceberg. There might be other pathologists out there doing the same kind of damage, you know, with hundreds of hospitals.
Yeah, you're right. Absolutely. Absolutely. It's scary, Dr. Bash, and you know about what my husband went through. You did 2 fabulous medical opinions for me, and I learned that if misdiagnosis starts and goes on for years, it has a snowball effect, because my husband ended up with 1 misdiagnosis right away and ended up being almost 300% disabled because they misdiagnosed 3 or 4 other situations.
No.
You know, and only Dr. Bash is the type of doctor that I just feel that you're so detailed, Dr. Bash, and you, unlike the VA, you read everything. You know, these guys, men and women, they hand in their claims. That doesn't mean VA is going to really look through their medical records or their service records real good. But you do that, and I commend you for being so, capable of, I mean, you see things that we can't see in the medical records. And if we can't see it, sure, the VA hasn't seen it, you know. So,
that's the way it's supposed to work. The doc should be able to pick out a few things that people don't see. But the other thing is, you know, you're right about the idea that the misdiagnosis can be propagated or be, you know, passed on, because kind of a little unknown concept is that docs are kind of afraid to change other docs' diagnoses.
Yeah,
You assume that doctor before you did a good job, or he had more data than you did, and so we're kind of reluctant to do that. So, especially like a nurse practitioner or PA is not going to be changing doctors' diagnoses. So, you know, if once that bad diagnosis, either normal or abnormal, gets in the chart, it can be a big problem for a lot of years, as we were talking about.
Yeah.
Well, they'll get it ironed out, I hope, without, you know, you would think they'd get a hold of these veterans ASAP, because there could be some real, you know, misdiagnosis
Yeah.
I run around all over the country.
Gerald, when I first heard of the story, it was in a Google alert. I get them all the time on lots of problems with the VA. I looked at the Google alert, and there were 2 articles there. The second one, instead of posting the link, it had it. I emailed the law firm mentioned in the article, and I emailed them. Within a couple hours, a lawyer called me, and we talked for quite a long time. He thought I was a lawyer. I said, oh, no, but I'm an FCCA'er, so I know how it goes. And I said, I have 3 concerns. And he said, every concern I had, his law firm had discussed already that day because they were already getting calls from veterans. But you know what another problem is? See, there's a statute of limits. And I told him that letter, the VA might call that the beginning of the statute of limits for an FCCA cause of action, and we still don't know yet. And I mean, between you and me, don't tell anybody, but the VA will do all they can to piss away the 2-year statute of limits. But veterans can still file an 1151 claim.
No, they can still sue too because the statute of limitations is also based on the date of discovery, and if this situation, the date of discovery just happened a few months ago, then they cannot use that 10-year rule.
Well, yeah,
because
it's
the
true.
most important term is date of discovery.
Well, there's quite a bit to it, and we discussed 2 other very important issues. One of them, he said, we're getting calls already from these veterans. He said, and they tell us their whole story. You know, like, oh, you know, they get tangential, and he's trying. This law firm's going to have to stick to the letter they got and whatever they get next from the VA, but they need their medical records because I told the lawyer, the first vet that brings you their medical records, you're going to be able to know the name of the pathologist. You're going to see it in the records, and I've narrowed it down to I think 3 people it could be because, well, that's another story. But in any event, they only need a brief form to get their medical records. Some of them are trying and waiting for the records, and they haven't gotten them yet. And lawyers cannot help them until they see those medical records. And luckily, a lot of the veterans will do that right away because the name of the doctor is in there. But I told the lawyer, you don't need a name to start a lawsuit because you will settle like I did with the United States of America. On my form, my SF-95 form, Dr. Bash, when I first started that process, there's a part there that says witnesses because, you know, this is the same form like, say, the post office runs somebody over. That's where you write down the witnesses. You know, it covers a whole lot of areas, not just the VA, but any federal entity. But as witnesses, I put down all the names of the doctors that treated my husband for 6 years that I could figure out because some of them, these were handwritten, notes, and a lot of the names were foreign names. They were very hard to find. But they don't need that. I didn't settle with a doctor. I settled with the United States of America under the auspices of General Counsel. So I was surprised that the lawyer I talked to didn't really realize that, but I think it's his boss that knows more about, the malpractice issue. But in any event, there's a lot to it. I think I better shut up because I could talk about this stuff all day and all night. But and I think I'm going to hang up and enjoy the show just sitting here in the dark with my computer and a piece of chocolate cake. My cholesterol's real good, Dr. Bash. Thank God.
That's good.
I'm a very old person, and I'm in excellent health. I just got a great checkup. But, I think exercise and eating right and staying away from the funny drugs and alcohol and smoking, it makes a difference in a person's life, But I'm going to hang up. I'm going to enjoy the show. And I hope others call in. And I hope they're listening. It's 347-888-8255. 237-4819. If you call in, you'll hear the English woman, and then you have to press 1 to get into the caller queue. So we'll see how that goes, Gerald. But bye, guys. Great to talk to you again, Craig.
Yep. See you later. Yep.
Okay.
Okay. Thanks a lot, Berta.
You bet.
Okay. Dr. Bash, you was wanting to discuss some of the items you had on your web page here, like CMP examinations and other different things you had here, sleep apnea.
Oh, yeah. I've got a lot of, on my website, I've got like a bunch of things called Bash Bulletins. And there's a bunch of different things on there that people could read and then ask questions about. One of the new ones I'm going to do had a thing about 6 or 8 reasons why you should pursue a 100% claim. Continue pursuing it. I looked at it and I made about 10 reasons. So one reason I thought about why you should pursue a 100% claim was that the medical codes are wrong, like we just talked about. The diagnosis is incorrect. So if you have a rating decision that has the wrong diagnosis on it, then you should, regardless of whether you're 100% or not, you should still go back and make sure that diagnosis is correct. That can make a difference down the road.
Yeah, because a lot of times they've been lowballing. We find that they've been lowballing veterans to where they should be 20, 30, 40% rating. They're giving them a 10% rating. And that's not right.
Yep, I see that. I'm also seeing a lot of 100%ers or 50%ers that get awarded, and then like a week or two later, the VA does some kind of internal review and takes them back to 0 or unrates them.
Yes.
Did you guys see that more recently?
Yeah, we've seen that. Because we had some veterans there on HADA that were afraid that, after they were awarded, that the VA was going to come back and hit them. But,
yeah. They do that a lot these days. I've never saw it before. They do it like in a couple of weeks. They go back and change it. The other thing is they're lumping diagnoses. So I saw a guy the other day that had like sleep apnea, asthma, and gastroesophageal reflux. They gave him 50%. So they're lumping all this stuff together. They lump spinal cord, bladder, and I don't know, something else unrelated, lung, together for 20%. They lump all these unrelated things all together, and the veteran thinks that they're rated for everything, and if you split them out, they'd have a much higher rating, but the VA lumps them together.
Oh, man.
So that
means a longer fight.
Yeah, right. So you got to unwind all that stuff, and the veteran doesn't know. He doesn't know that these things aren't related. He thinks he tells his buddy, you're rated for asthma. Yeah, I'm rated for asthma. You're rated for GERD. Yeah, I'm rated for GERD. And I'm rated for sleep apnea all together for 50%. Oh man, because sleep apnea by itself is 50%. If you're on CPAP. So that's one reason you should go back, make sure the code's right. Another reason is looking for secondary medical conditions. So, say a guy has a spinal cord injury and then he gets kidney failure. Well, that kidney failure could be a secondary reason to a spinal cord injury, and so he should go back and correct his record and make sure he gets secondary conditions, even if he's 100%, because he can get into the SMC codes. The third reason I thought about was like this thing called tertiary conditions. So say the guy has spinal cord injury, and then he gets kidney problems, and then he gets a stroke from his kidneys, hypertension. The stroke might be a tertiary condition, secondary. And he should go back. That just should, even if it's 100%, should go back and make sure he gets connected for that. Mm-hmm. So, another reason I thought about was prevent future reductions. I think that if you have a lot of claims and they're all interrelated, intertwined cases with a lot of different things, it makes it a lot harder for the VA to come back in the future and reduce you, because you have to go through a lot of different hoops to do that. So I think that the more claims you have, the more cases you're rated for, the less likely they are to, cut you from 100 down to something real small.
Well, yeah, I'd say if you get up around 200-300%, it's going to be hard to cut you back. But A lot more difficult, anyway. But where they got you low ball going in, then they come along, maybe raise it a little bit, and they get upset with you. They cut your ratings.
Right. Or you go back and ask for an increase, and they cut you. Right.
Yeah.
A lot of guys go for increase, and all of a sudden they end up with half as much as they started with.
That's usually where it happens at, is when they're asking for these increases, and I don't think it's fair that the VA does what they're doing there. They end up cutting their benefits instead of increasing them, putting them up where they belong.
I've had really good luck. with the severances. I don't think I've had a single severance yet that the VA tried to sever a guy that I didn't get it reversed. But there's a lot of rules around severances. They have to give them another exam. They have to give them a chance to appeal. They have to give them, 60, 90, 120 days to reappeal. So I've been lucky with those. So the veteran shouldn't be afraid to go after the benefits he needs, but at the same time, he's got to have some advocate help him too, because he can run him over. Number 4, number 5 is the veteran should know that 100% is often not permanent, right? 100% is not permanent for 20 years, and they can't change the code at 10 years. So a lot of veterans see that the permanent total, but permanent total is not really permanent total rating. It's just a designator for stat taxes and other kinds of benefits.
Yeah.
So that's important for veterans to know.
Yeah, because if they change the codes, then they would want to come back and do a number on you again.
Right. Another one that had it talked about was TDIU. The idea that TDIU is not 100% forever. They talk about phasing the TDIU out at a certain age, right down the road.
Well, I could see the brain making some improvements, but I don't think much. I just don't
Right.
TDIU that's a bad one anyway, because it's so hard to get, and they really messed over a lot of veterans and calling it a personality disorder.
Right. Yeah, right. And they're talking about phasing that TDIU out when you get to be a certain age, like when you're eligible for Social Security or whatever. They might change, some words about that. So veterans should be careful. They should try and get. Go ahead.
Getting Social Security ain't going to help your TDIU.
I know. But they were talking about maybe trying to change that, where they might reduce the TDIU if you're eligible for that at a certain age. Phase out the TDIU.
Oh, I just don't see that.
Yeah.
Well, it could happen, but it's something that shouldn't happen. Some of these guys really got hit hard.
That's Mr. Nick Mulvaney in the budget office, the budget director. That's his idea.
That's his idea? You think that's
Mick Mulvaney.
Think that's going to get any wind? If you don't get any wind, it'll die. Hopefully die.
From what I hear in my circles, no. But
okay, good.
The Agent Orange bill passed on the House.
Which one? What part?
Their Blue Water Navy bill. Blue Water Navy folks were exposed to Agent Orange. Blue Water Navy
Blue Water,
guys,
right. Yeah, right.
Yeah, so now if you go get a VA loan for a house, you got to pay extra fees for it to pass the Senate. The veterans are paying the Blue Water Navy.
Oh, I see. They're going to pay the fee to cover the Blue Water Navy.
Yeah, it's called Robin Peters Pay Paul.
Right. So the Blue Water Navy is going to be considered just like boots on the ground, right, Agent Orange?
Mm-hmm.
Thank you all for listening. That ends this show, and now I'm going to zoom off.